Hi, good evening, everyone. Welcome to the Community Recovery Advisory Group meeting. I'm Adriana Hochberg. We will start broadcasting on county cable in just a few minutes. I just wanted to let everybody know about that. And we'll just wait maybe one or two more minutes so a few more folks can join us before we get underway. Good evening, everybody. I'd like to welcome you to the Community Recovery Advisory Group meeting. Today is August 12th, 7 p.m. So thank you so much for joining us on this rainy evening. My name is Adriana Hochberg from the County Executive's Office. And I'd like to introduce you to Elijah Wheeler, the Community Chair, to get the meeting underway.
Thank you, Adriana. Good evening, everyone. I hope that you are well, safe and sound indoors, in good health as well, and hopefully not in the space of a flash flood. I think a lot of us just got that on our phones just now, the warning for the heavy rains that are coming our way. So I hope you're staying out of the way of that at this current time. Welcome to our CRAG meeting, Community Recovery Advisory Group, this evening on August 12th. Just so you all know, we are currently live on Montgomery County Cable as well as YouTube this evening, being broadcast. So just a quick overview and a reminder that the Community Recovery Advisory Group consists of you all, representatives of a spectrum of different communities here and populations in Montgomery County, as well as issue areas and institutions that are currently being impacted by the pandemic. The purpose of this group is to advise the county executive and county council on the needs of the community and recovery, and how the county can achieve a new normal that is more equitable than we experienced previous to the pandemic. Looking forward to a very rich conversation this evening. The topic will be childcare, as requested by you all at our last meeting that we have. We have two guests this evening, as a matter of fact. The first guest we have is Bibi Otero. She currently serves as a special assistant to our county executive. She has a specialty in the early childhood area, as well as Barbara Andrews, who's currently the administrator for early childhood services at HHS. So we're happy to have them joining us this evening. Look forward to a very informative conversation as they provide us with an update on what's happening currently with the issues of childcare as it relates to the pandemic. So I was trying to stall a little bit to give Earl Stoddard opportunity to join us, but he's having some connection issues joining us this evening. Hopefully he can hop on any moment here. Before he does, however, what I want to do is swing over to Barbara Andrews for a quick overview and update. Okay, Earl. Barbara, you got saved by the bell. Earl is here. So before we get started, I'm going to throw it over to him, and then we will welcome our guests.
Just in the nick of time. Thank you, Elijah. Appreciate it being on this evening. Sorry I was late. Some storms rolled through and it I think it messed with my Wi-Fi. I had to reset my router, so everything seems to be working now. So thanks again for everyone coming and attending. We're very interested in this conversation with childcare. I know BB and Barbara know way more about this issue than I know, but I think the important thing that I do want to say is this is an area where we've recognized there's a great need, and a great need in terms of safety as well. Childcare operations have been largely open across the county, whereas schools have been, certainly our public schools have been closed since we were averaging 4 cases a day. And so obviously there has been some experience in understanding how we can do childcare in a more safe, effective way. But we know that there is more need within the community, particularly in light of the school closures, to offer some additional options. And we're trying to look at options that can allow us to continue to be safe while also recognizing that there is need within the community for some options. So I don't want to take any more of their time, because I know that they're much more expert in this than I am, but that's sort of our goal, is to have safe options and increase them as we can.
Thanks, Earl. Appreciate it. Glad you're here with us this evening. So, Barbara, if you're able to unmute yourself.
Yes, I am. I've been having a lot of connectivity problems, so I'm not going to put my video on because it seems to kick me off numerous times during every meeting. I'm Barbara Andrews. As Elijah said, I'm the Administrator for Early Childhood Services in HHS, and I'm also chairing the Early Care and Education Recovery Committee. I'm going to give you a little bit of an understanding of what we've been doing in this committee and how we started. There is a large early childhood initiative happening in the county. We already had a steering group. BB is part of that. And we were able to transfer that steering group, which is an interagency, also with some community members on it, group, and make that our recovery group, and then add people as needed. We developed several committees that I'll talk about in a minute. But the main thing was, at the very beginning of all of this, we were really seeking to provide child care for essential employees. Joanne Barnes, Chief of Children, Youth, and Families, and myself were trying to work with our child care and public space programs to see if they would be able to remain open. And we were working with the YMCA and a couple of other groups to see what might be possible. In the meantime, as we were trying to get that up and running in the county, the state took over that issue, as you probably know, and provided child care for essential employees, allowed child care programs to open under certain circumstances. And they also paid for the care, which was paid for out of federal dollars. So we went very quickly into support mode for child care and early childhood programs. One of the things that we did was that we provided a supplement to that payment, because the state's payment was not high enough for Montgomery County costs. And those supplements are being paid out this week. They'll be completely paid out. And then we were working to interpret the state requirements versus the county requirements, and obviously the state was further ahead in phases of opening than the county was, and we had to make sure our website said the things that did not confuse our child care providers, but supported them in understanding exactly what they could and could not do. One of the main things you need to know is that child care is a heavily regulated field in this state, and it is regulated by the state. So Montgomery County has no regulatory oversight of child care, and it is regulated from birth to age 12. So before and after school programs, camps, some camps in the summertime, most larger camps that run for longer than 6 weeks are actually regulated by the Department of Health, but before and after school programs can become camps in the summertime, and if it's less than 6 weeks, they're regulated by MSDE, and they don't need a separate license. So in our process, we started working on several different areas. We worked on health and safety areas, we worked on financial support, we worked on communications and engagement, and we worked on child care and public space and facilities issues. We've had a lot of success moving things forward. We have a very good relationship with the State Department of Education and the Office of Child Care, which is the regulatory agency. And so when things aren't making sense to child care providers, or the right supports aren't there, or the right communication is not there, we're able to have those conversations. We had a number of engagement opportunities for child care providers. Bibi Otero and Jennifer Arnaz, who runs our Resource and Referral Center, ran these child care chats for several Monday evenings in a row, where they were talking to child care directors or child care staff or family child care providers, and some were done for Spanish-speaking only. We also held a community forum that the county executive was at, and that Dr. Gales was at, to help answer questions. Constantly working on the communication to make sure that we're being consistent in what we talk about, and making sure that child care providers are clear on what supports are there for them, and what they need to do to keep children safe. We did have, I believe we had more than 200 programs open that in the county that were, and many of those were family child care programs that were supporting essential personnel. The state has now stopped having those specific programs. One were called ESSA programs, which were for school age care, and one was called EPIC programs, which were for early childhood care. They are no longer paying the care, and at a certain point, child care programs were allowed to reopen across the state with just some paperwork responsibilities. All child care programs are following strict health and safety protocols. They're following CDC guidelines, they're following state public health, they're following MSDE guidelines, and any county public health guidelines. We have worked on a resource for child care providers that's a guide on what you need to know when operating under COVID, that also provides some information that they can use with parents, so the parents know that the child care is taking serious precautions. And it also has guidelines for parents about when they drop their children off and pick them up. And that resource guide will be ready shortly. The state did finally put out a full COVID guide that came from the Department of Health and from MSDE, that outlined all the precautions that need to be taken, and also outlined, if you have a COVID case, what do you do and when might you need to close. We are working with our public health department to be sure that we're all in the same place and we're giving out the same communication, and to be sure that when child care providers call, because if they have a case, they're supposed to let their licensing specialist know and call our public health office, and so that when they do call, that they get the right advice and they know what to do and exactly what their next steps are. We also were providing through Earl's office PPE and cleaning supplies at no cost to child care providers. We had numerous, I don't know how many weeks, Earl, maybe you can tell people, but we had numerous weeks of pickups on certain days where providers could come. They could register and then come and pick up these supplies. And we are now working on finding a co-op that can help us work with vendors in order to continue supporting that for child care providers. We're working on ways to pay for that, and then eventually, as they get higher enrollment in their programs, they'd still have access to it, and they take on the cost themselves. Financial supports is a huge one, and we do have a child care fund in the county. It's a $10 million fund. We're in the process of reviewing the applications for that now, and by the end of next week, we will have the awards out. Bibi may want to talk a little bit more about the child care fund specifically. And then we were working with child care and public space in particular. So there are several child care and public space programs in the county, one of which is an HHS program. It is a program that incentivizes child care programs to go to lower income areas of the county to provide care. And we were able to work with MCPS to get those programs reopened. So they've started a couple of weeks ago, or are in the process of starting. And then MCPS also rents space for child care directly sometimes when they have additional space, and they were able to allow those programs to open. So the big issue left on the table, which I know you all were discussing, is the school-age child care and what that looks like. Those programs, there's school-age child care all over the county, but the public space child care is administered by CUF. and they lease the spaces that are in MCPS sites. So that's what we were focused on, was whether those sites could open. We just got word today that Ramona Bell Pearson, who's the director of press, was working with Essie McGuire at MCPS and also with the Office of Child Care and with the child care providers, and they've been meeting several times, that they will be able to open by September 14th. They have put a proposal together that explains that they're taking all the same precautions that I just described that the child care providers all over the county or all over the state are doing, probably all over the country are doing. The big issue there was to get the state to allow them to have possibly a different space in the school than they usually do, because it is a space that is licensed. And for school-age care, one of the primary issues is the square footage and how many children do you have and how large a space. The schools needed the flexibility to be able to utilize their space, and oftentimes these programs for school-age care are in the all-purpose room. All the schools will be serving food this fall, and so that caused some issues with the schools planning. But with OCC allowing that flexibility, we'll be able to open those programs. I know one of the big questions is how can you not open schools, but how can you open full day? The child care programs will go to full day. How can you open full day child care programs for the same children? My main argument for that is that when you're talking about opening schools, you're talking about thousands of children, even if it's staggered, even if it's small groups, and you're talking about busing them. And this is a very different situation. Child care programs can only be licensed up to a certain number of children, and under COVID, they can only have 15 people in a space. So if they are able to have 2 spaces in the school that are the right size and can be licensed properly, they will only be able to have 30 people in the program. It's considerably fewer children. It can be better self-contained. And the schools are most of them are in elementary schools, and the schools are talking about possibly using the kindergarten wings because there are sinks in the classrooms for washing hands, and there is there's more bathrooms, so there's less need to share bathroom facilities, for instance. Phoebe, did you want to talk a little bit about the fund or anything else?
Sure. So we worked with the council and put a fund together for $10 million, roughly 3 point something for family child care. And I know we're using a lot of terminology that some of you may not be as familiar with. So please put in the chat if there's something that you don't understand and that you don't that you need us to explain. But basically, family child care are licensed homes that care for children up to, I think, 8 children in a home. And those are, again, licensed, like Barbara said, by MSD. And so we created a fund, understanding that many centers were closed as some reopened for essential employees, but that still was not at their full capacity and their full enrollment. And as any of you who may have been involved in childcare at any time know, that childcare is a business that often is functioning in the red or barely making ends meet. So when you ask them to reduce the number of children that they can enroll in their program, there is a huge financial loss. And obviously, if they close, the financial loss is even greater. So the fund is meant to support child care centers and family child care for some of their losses, as well as the costs of reopening. So the process was put in place. There were electronic applications. We put a couple of organizations out to provide. We contracted with a couple of organizations to provide technical assistance to make sure that we were that those that may not have the skill sets to fill out an application in this way, or look at the financial situations in the way that we were asking, had the same opportunity as some of the larger providers that maybe have more administrative support or financial systems in place. So we wanted to make sure we made it as equitable as possible and as accessible as possible. We had I I think Barbara talked about how many applied. I think we had 600 and some applications. We'll be able to get those awards out. The maximum a single site can get is about $75,000, and we know that there are providers that have multiple sites, so there are increments of dollars per number of sites that the providers have. We also made sure that there were some priority points to things, certain areas such as sites located in particular zip codes, sites serving low-income children or subsidized children, and I think special needs was the other, and meeting quality standards, state quality standards was the other. And so we made sure that we use some of that, that we use those to help prioritize some of those applications. I just want to add to, I mean, Barbara just gave you a really good lay of the land in terms of what's going on, but I wanted to give you a little bit of a sense that, you know, this is a conversation that's being had not just in Montgomery County, not just in the state of Maryland, but across the country. And I receive almost daily reports and studies that are being done around the state of childcare in the country, and it is very, very grim. Again, for the reasons we said, childcare is a state and federal regulated business, but it is primarily small businesses run by mostly women of color, that are either child development centers or family child care homes. There are certainly large organizations out there with multiple sites and corporate headquarters and that sort of thing. But by and large, these are small businesses and small not-for-profits. And so, like any other business, the COVID and this emergency has really placed them in a very precarious situation. But they are the lifeline for a lot of families. And we know that we've got a very large participation in the workforce by women who, many years ago would stay home and care for children and now are in the workforce. And I think we have like a 72% participation of women in the workforce. And so all of those families need the child care, and in order for businesses to come back up and for us to get back to some level of normalcy, child care is a really critical piece of this. And we are now really understanding and beginning to, I think, see as a country that child care is as much an essential business as many others that we considered essential employees early on in this initiative. So that there is no easy fix for this, and it will require federal engagement and involvement at a very significant level. The projection is that by this time next year, if not much changes, we will lose 50% of the child care in the country. More in certain jurisdictions than others, but that is about where we will fall, and that is just a significant loss. So I just wanted to put this in perspective and in the context, our perspective and the context of what's happening nationally. And the conversations we're having here are not unlike those that all states and localities are dealing with. The final piece I would say, related to what Barbara said and reinforcing, is this is a regulated, highly regulated business. And that means that if we've heard a lot about people who are trying to put a group of kids together, create something like a pod. Let's be very clear, what Barbara's been talking about has been regulated childcare, not pop-up kind of pops. Hubs or whatever various folks are calling them, and that in fact it is not legal for someone to care for a group of children who are not directly related to each other and to the person caring for them in a place other than their home. And so a lot of these situations where parents are trying to pull a group of children together and calling it childcare or calling it pop-up or calling it hubs or whatever, those are in fact not, according to Maryland law, not legal. And so we need to be careful in terms of, and I want to give Ramona and Barbara and others and the school system lots of kudos for really working very hard at trying to address this issue by going up by ensuring that we're using all of the appropriate safeguards and that we are working with those who are licensed to provide the service.
Thank you, Barbara and BB. We appreciate that overview and that additional context to add into this conversation this evening. As a reminder for folks who hopped on late, we are being broadcast live on County Cable as well as YouTube. We get involved in the question and answer period here. If you have a question, you can go to the Q&A section down below in Zoom. If you want to enter the question there, you don't want to actually ask the question, you can do that. You can also click over participants and raise your hand as well too. I'll also be screening or scanning the screen, excuse me, looking for people who raise their hands physically. So with that being said, let's open up for some of the question and answer period here. John, you had your hand up first. I'll go with you.
Thank you so much. And Barbara and BB, thank you for the information. One of the things that I'm concerned about, well, let me begin that I'm appreciative and understand the need to have these childcare centers opening up and using school facilities. I think in some ways that makes sense. But I'm just curious, a concern I have, and BB, you mentioned pods, is that the childcare facilities that are in places like schools are only going to be accessible to only certain families and not others. I mean, I've even seen some advertisements already. One facility talked about how they got approval to be an MCPS and they're going to have childcare from 9 to 3, and the cost, I think it was like $1,200 or something. So I'm just curious, are there ways that we can give priority to having school settings to programs that are going to be more affordable to the families that need it? Because BB, you mentioned pods. The reality is that most of the families who are creating their own pods or whatever, they have the means to do that. But the families that are in apartment complexes, the families who really have no other choices, they don't. And my fear is that the businesses who are getting the cup and getting the access to MCPS schools aren't going to be affordable for the families who really need it the most. So I'm just curious, what can be done to prioritize those families so they get the childcare they really need?
This is Barbara. Let me just mention what I didn't mention before, is there are some priorities for the school age care. I have a fan running. Is that a problem? Turn it off. Sorry. There are some priorities. One is essential care for essential employees. Another is care for teachers. But the third is children in Title I schools and children in schools with high farms, free and reduced meals. There is, and I think BB could best talk about this, there is an issue with the cost and finding ways for the child care for lower income families to be paid through subsidy. We do have an issue with the state not being able to change their subsidy payments to full day payments. BB, I think you can best explain that particular issue if you want to.
Sure. John, thanks for the question. That's absolutely the right question, and that's absolutely what we should be thinking about. We do know that a significant number of the child care providers who are licensed in schools are in Title I schools. But your question, which is how are parents going to pay for it, how are providers can't provide this for free. And so we've had a lot of conversation about that. We are looking at what is the possibility of creating some sort of fund to help support that, so that providers can in fact take children who cannot afford the full cost of full day care. What Barbara said is correct. The state that provides scholarships, and I'm sure many of the children that are low income that are in these programs are receiving state scholarships. but the state will only pay the before and after rate because they, at least what they've said is the state is already paying for those children to be in school and to also use state dollars to pay for them to be in school but not in school is double dipping. And so, and we have our own WPA dollars in the county that we certainly will be looking at, but we've often use those dollars to supplement state dollars. So I know this isn't a perfect answer, but we're very well aware. We are really, in our meeting today, we talked a great deal about this. This is a real opportunity for public-private partnership around us. We know that philanthropy is very interested and are worried about this also and are looking to raise some funds. So maybe there is a way for us to pull some dollars together from both the private sector and the public sector to make up the gap, if nothing else, for those children who are on scholarship and WPA is only paying the before and after and not the school day part of the services. There are also a number of child care centers that provide before and after that are not in school buildings. Those are also providing care, most likely for those families who can afford to have the care. And so it's a really critical piece. We've asked for the data. So the first step is to find out how many of those providers currently are in Title I schools, how many are paying for, are getting requests if they're from low-income families. If in fact the agreement with the school system is to first and foremost identify low-income children, then we need to get a count, and then we need to get a sense of cost and be able to cost out what it would take to support as many of those children as possible. I hope that answers your question, and I know that it is a huge concern for many of us. The children you spoke about are most likely being left alone, are most at risk of being in unsafe situations or being cared for in very unsafe situations. So you're absolutely on target and right about that. I think there was another, I'm sorry, Elijah, you're managing the questions. I won't.
I would just add, I think that's part of the reason why we're having this conversation. We're in the middle of trying to figure this out, and I think your all feedback is going to be important to what direction we go into. So we don't have final solutions here. So I will only say that your question is exactly the first thing we talked about, is that, there's a totally obvious equity issue here for the public schools to be utilized by for-profit institutions and not for those who need the resources the most to have access to the resources. And so we've been thinking about some potentially different strategies for how we can, for example, these providers do operate, they need our consent to operate in these facilities, and perhaps we could work out a partnership with them to say, you can offer a second room in the building beyond your licensure. We'll help you get the licensure with the state, but in order to do that, you have to provide us a certain number of slots at a lower rate, for example. Yeah, go ahead.
Yeah, I was just going to say, in addition to that, I think of jobs as well, right? There's so many young people, college age and whatnot, who this has been their livelihood. I think of the childcare. So my daughters went to East Silver Spring Elementary School. They had global childcare. It was mainly run by college kids. And I'm sure that many of those kids, or I call them kids, but many of those students need jobs as well. So I feel like this is a great opportunity for a win-win. How can we give jobs to younger people or people who need it, and give childcare and support to families who need it at the same time? And that's the type of, Earl, I appreciate the creativity and thinking of ways to do that. I think that's so important.
This is Barbara. I would just mention one thing that Earl said. Some of these child care programs are for-profit, but many, if not most, are non-profit. So I just want to be clear about that.
Barbara does, so listen to what she says.
I also want to be really careful that even though they may be for-profit businesses, they have no profit. I have been in this business for 35 years. And there is no such thing as profit. They may have chosen not to go the nonprofit route, but it's not like like with some exceptions in terms of large corporate entities, which do have some level of profit. The large majority are not those. They are multi-site businesses that are providing pretty much at their cost, right? John, I think you're right in terms of jobs, but I also think there are an awful lot of early care and education and childcare teachers out there that are unemployed right now because childcare has been closed.
Yeah, that's true.
And so it's a combination of those. And again, our childcare regulations have requirements about certifications and licensures and so on. So just making sure that we're aware of that also.
Great. Thanks. Great opening question, John. Appreciate that interaction. Yes, there is a question, actually, Bibi and Barbara in the chat, and the question is whether or not there are any kind of provisions currently for children who are special needs as in terms of childcare.
Barbara, do you want to talk about that conversation with CUFs and the school system around the special, what we've heard about what the school system is doing with special ed?
Well, I know that part of the reason that they are comfortable in having the small cohorts of childcare come back into the schools is that they're working on some small cohorts for special needs education in the schools, in small groups, but face-to-face, because the distance learning is not always working for those students. Most of the childcare programs do, they don't turn down children with special needs. It depends on what level of support the child may need. There are some other programs in the county that focus exclusively on special needs. So that, I mean, that's what, is that what you were asking me to talk about, Bibi?
Yes, the fact that there's been that conversation that the school system is working to look at how they support the special needs kids on a face-to-face, because those children can't always be on a virtual platform.
Yeah, I would only add that Deputy Superintendent McKnight and Ms. McGuire, Esty McGuire, have actually, in their conversation with Dr. Gales and I, that was specifically one of the areas that they wanted to try and see what they could do in. They recognized that particularly for the special education population, that remote learning is even more potentially deleterious than for other groups, which we know it's also deleterious for. And so, thinking about having paraeducators and others available in certain school environments for some sort of in-school programming is something that they're actively working on. We said absolutely we'd like to look for areas where we can do some of this. And so if you go, they're going back and working on a proposal to do that, with the thought process that wouldn't start corresponding necessarily exactly with the beginning of the school year, but certainly, at early fall was the timeline that they were looking to operate in, and they want to make, we gave them the go ahead. We're going to support them. We'll work with them to get them the necessary protections in place to have that happen.
I would also just add a couple of things real quick. Not just in terms of the special needs, but just making the distinction that we have childcare providers that are licensed for early childhood, the youngest children. There are also many that are licensed for both the younger children and the 5 to 12-year-olds that Barbara talked about, and then others that are only licensed for those 5 to 12-year-olds. So they sort of, that's the range, and all of them are required by law to take any child that basically applies, and that includes all special ed children. I wanted to also recommend to this committee, Elijah, and I know that this is dear to your heart, that there is the whole population of over 12-year-olds that I hope this committee will have a session like this on what's happening to those middle and high school and the teenagers in terms of services and ways to support their educational. I know that that's something that you would be paying a lot of attention to, but just wanted to make sure that we're clear that we're speaking really the elementary school children, but that there is a whole other population that we need to be paying attention to.
Thank you, Bibi. I appreciate that. Folks, I'm not sure that Bibi and Barbara can see you all as I call on you. So when I do call on you and acknowledge you for the question, if you could just announce yourself, I think that that'll be helpful as well, too. Karen, you got a question. You're muted, Karen.
Sorry about that. About 2 weeks ago, several state legislators wrote an editorial basically appealing to the governor, pleading with the governor for more funds for childcare and pleading with the governor to access more coronavirus funds for childcare. They're really particularly concerned about something that you mentioned, that next year we may not have a lot of, childcare centers open. What are the chances? I'm sorry, they also cited the Michigan and Vermont models where those two states requested money for coronavirus. And I think in Michigan, they were providing up to 30% subsidy per child. What are the chances that there's going to be some movement from the governor's office, or have you seen any clue that there may be some movement from the Department of Education or the governor's office on this?
Let me start and I'll throw it to Barbara if she has additional questions. We've not seen any movement. The governor's office, as Barbara explained, came out very early and provided the funding out of the CARES dollars for essential employees. And they did pay for childcare for essential employees for a pretty significant period of time, and they used the CARES dollars for that, or some version of combination of federal dollars for that. They have stopped those payments, as Barbara shared, and they are clear that they're not paying subsidy for school-age full day, even though children are not physically in their schools. But we have not seen any further movement in terms of additional dollars. What we have gotten, which I credit to everybody's advocacy around this, is that this movement around allowing childcare to operate, licensed childcare centers to operate in the schools for out of school time with some flexibilities of the space that they were utilizing. And that was, I thought, a really a big leap for MSDE in terms of allowing that to happen. But in terms of funding, we've not heard any additional movement around that or any notion of that. Barbara, have you gotten any sense around that at all?
Not related to childcare. It did go through in the governor's budget additional funds for the infants and toddlers program, which is a specific program for children birth to 3 with disabilities. And they did put money in for creating more family support centers around, which I can explain if people need me to. But none of that is specific to childcare. It's specific to early childhood, but not childcare.
And certainly not specific to this emergency. So many of those others are functioning virtually, but they're certainly not functioning on face-to-face with children.
Okay, thank you.
And Barbara, who are you? If folks would tell us who you're with, it would be really helpful to know, because I don't necessarily know anybody.
Sorry, it's Karen Brito. I'm just an independent. I'm not with an organization.
You're an independent Karen, okay.
An independent Karen. Yeah, thanks.
Thank you.
You're welcome. Thank you for your presentation.
Great. Next, we'll go to Laura. You have your hand up.
Thanks. It's Laura Stewart. I'm a Vice President of Advocacy for MCC PTA. And I just wanted to let you guys know that I've been on several Zoom meetings with PTA parents who are planning for the year coming up. And many are worried about the equity issues, which we've touched upon here. Many want to contribute to help these kids that normally might have not been in the position to need before and after care. Maybe they had a sibling take care of them. But to go through a whole day of school with maybe multiple elementary school kids and then a high schooler home trying to guide them through school, this might not even be a particularly safe situation, we don't know. So they wanted to know how could they contribute to get some of these kids into a little bit better situation. So some of them are talking about scholarships for their in-school programs. And I know that there was one of the for-profit organizations, I think set up a nonprofit to help so people could contribute to scholarships. Anyway, is there any kind of coordination there? Because there's one side issue though. The schools that have more resources will collect more scholarship money. And then you have the schools that are 80% farms, 20% are not going to be able to fund those 80% of the kids, even if there's already some kind of funding. So I thought maybe we could talk about that.
Laura, I think the more equitable way of doing it is not doing it school-based, right? And so, Elijah, I would say the conversations with Kimberly, I know that Kimberly has been having, Rosick from the Community Foundation has been having conversations already around this issue and around creating a fund. And so I'm wondering whether those conversations can include the fact that there are folks who may want to contribute to a fund, not just foundations, but individuals. And so I would want Laura to connect you with somebody like Kimberly Rosick, if you don't know her already, and make sure that that there's some information there, because then you have a more equitable distribution than school-based. I mean, we've known that for years, that wealthy schools have an ability to provide certain services that schools that are 100% Title I, for example, may not be able to. And so I think the idea of a fund that can then be distributed, and this partnership I talked about earlier in terms of a private-public partnership where there may be dollars at the public level to match some of the private dollars, might be a really good way to create that fund. So I'd be happy to share that information with Kimberly and then
She's
see
on
if
the
there's
phone, Bibi.
Huh?
Kimberly's in the meeting. She's written.
Oh, Kimberly. Oh, well then you should answer, not me. I didn't know you were in the meeting. Jump in, please. I don't know if she's heard me or not, but we'll make that, we'll follow that up, and if she hears this, then she will chime in.
Great, thanks. Any kind of
Is
coordination we can.
Kimberly a panelist? She may have to be pulled up, I think, potentially Ben.
Yeah, I just promoted her.
Okay, good.
Oh. You need to be promoted. This sounds like a school situation.
Yeah, so Kimberly, you should be able to unmute now.
Yep, great, thank you.
So Kimberly, I've been speaking on behalf of you, so please, I didn't know you were there. Go ahead.
No, that's great. Thanks, Bibi. Yes, so the Children's Opportunity Fund, which is a fund housed at the Greater Washington Community Foundation, is working on this exactly. We're able to accept donations from individuals at all different levels in terms of wanting to provide scholarships. We're trying to coordinate with the childcare providers and taking this equity lens into account to make sure that some of the students that are getting access to these scholarships and to these learning hubs that are being provided in schools are for, Title I students, low-income students, students of single parents, especially targeting our Black and Brown students, and working with teachers and counselors and principals to make sure that we're finding some of those families who are in need of this type of support and getting access to it. So I'm happy to share my email with Elijah. My email, if you want to share it with whomever is on the
because we want to stay
please feel free to
coordinated.
reach out.
Yeah.
Kimberly just made me realize that I should mention that the other thing that the school age providers in schools are doing is they are coordinating with principals on finding the families that fit those requirements that I mentioned.
Thanks, folks. Appreciate that. I'm trying to capture some of the stuff in the chat as well too during the course of this conversation. Any thoughts on supporting the capacity of faith-based organizations to fill in some of the gaps?
Again, I would say that if, there are a number of faith-based organizations that are licensed, that have licensed childcare centers, and I would assume that much like these school-based, and again, looking at the whole picture of who needs support and care, that if they are licensed to provide childcare for school-age children, they are most likely also going to need some of that same kind of support that we're talking about, those that are licensed for schools. And so I'll make the commitment to work closely to coordinate this with anyone else who is, with Kimberly and Laura and others who may be interested in figuring this out more. I know, Kimberly, you've gone much further ahead in this work, and we've started to talk about it within the context of government, but I think we have to come up with solutions, and we have to be really creative about this. And the realities are that we're going to have to really trust on providers and on principals and others to identify the families and to figure out where there is the greatest need.
Thank you, Bibi. Thank you, Kimberly. Kimberly put her email as well in the chat for those of you who want to reach out to her and ask some questions about the scholarships as well too. Next question, let's go to Deborah. You had your hand raised. I see you, Christy. I'm going to get to you.
Okay. Thank you. I have lots of questions. I'm going to just try to limit. Just a couple follow through. I'm Deborah Fisher. I'm an independent consultant, but I work with the disability community, adult disability community largely, and also am a trustee of the Healthcare Initiatives Foundation. And my first question was just a follow on to the disability question, which has to do with these are children who, for the most part, really can't learn on their own. So that this notion that childcare is before and after doesn't work. And so I'm wondering what, if anything, can be done to build in that school period supports, even if it's with childcare, setting aside the fact that whatever in-school accommodations may be made are likely to be minimal for now. And certainly these are children who are more vulnerable, so parents can't provide those supports. So I'm just a little bit concerned that that school period leaves those children with no source of support for their academics, especially when you get to the behavioral health kinds of issues that arise.
Let me respond to that, Barbara. We are, I'm sorry, Deborah. We are, in fact, talking about licensed providers who provide before and after school, but because of this situation, would be full day.
Okay.
Okay. And that's the gap in funding that we've been talking about, right?
Okay.
So
okay.
They are generally funded for before and after by
Right.
subsidy or by the parents, and now the parents would have to pay the full day cost, or we would have to look at funds that would help pay for the full day cost. So the idea is to open up the school spaces that are licensed for them to be able to do full day.
And the schools are not yet up.
The schools are also talking about doing some, and you will have to talk to the school system about this, but what we've heard in the context of our conversations about childcare, we have heard that schools are also going to do some face-to-face school day with special needs children who absolutely cannot do virtual classes. But we don't know the exact makeup of that, or how many days, or in what, or how they're going to select the children or any of that. But that has come up in our conversations about the full day care.
Okay.
They're working on all that for sure. I mean, obviously they've got issues working with the educators as well, so they've got to get them on board with it. So they've got a lot of work to do in the background. What we've done is essentially said we will support it and do whatever the county needs to do in terms of the public health provisions that would need to be in place to work with them. They've taken that and started to run with it. So more to come on that.
Including like providing PPE and stuff like that, which would enable.
Yep. Yeah, we even talked about the fact that we know that some students who would fall into the special education program may have challenges wearing PPE for extended periods of time. Like
Right.
we recognize all those issues, and we're committed to working them through with them. Obviously, we just view it as so important to that population that they have access to in-school opportunities. You know, and so we're going to work with the school system to do. We've talked through some of those issues. There's a lot of planning that goes on, so I don't want to, there's just a lot of planning that's going to happen.
Thank you. I have a second question, and then I'll stop, which is a follow-on to the faith community. There are a number of congregations that typically provide childcare, and I'm just wondering about the possibility of the county looking at contracting with these programs since they're closed. I think many of them, they're in school. Face-to-face programs are not opening, and I'm just wondering about looking at contracting with these groups. I mean, they're losing funds also by not being able to provide these programs. In theory, they have the facilities, they have the staff who would probably qualify, because I presume they meet some kind of regulatory criteria as preschools, or I'm assuming they're set up as preschools. Have we looked at that kind of a partnership and reaching out to our faith community in that way?
Well, what we do know is that there are a lot well, Barbara, I don't know if you know the number of how many faith-based early care and education centers we have, or child care centers we have, but there are a number of them. We do have this early childhood fund that has been put in place, and so I'm going to assume that a lot of them have applied for those fundings. I don't know, because I don't have the list. I haven't received the full list of who has applied for the funding. But we don't have a contracting mechanism at this moment. And if they're not licensed for that age group, then if they're licensed for school age, then there's a possibility that they could be part of any of this discussion we're having about school-based. But if they're licensed only for early childhood, and I don't think it's called a license, it's called something else for
a letter of compliance.
Letter of compliance, but basically it's, they're authorized to run a program. It depends on the age group, correct, Barbara?
The license, yes. I mean, they would have to be licensed for school age care to be doing that. If they're licensed, otherwise they'd be licensed for children 4 and under, and that's in faith-based programs, that's usually called a letter of compliance. It's mostly the same requirements, but it allows them to teach religious teachings as part of their program and still be licensed by the state.
So it just strikes me that many may, but I wonder how many have thought of it, because it's not typically in their wheelhouse to be thinking about being open to the community. Well, and I don't know.
Go ahead. I think
I'm just wondering it.
Yeah. I think that most of the childcare programs and or preschools that are part of faith-based communities are trying to open. I'm not sure if you're talking about something different, but the licensed programs, most of them are trying to get reopened, and my guess is, along with BB, is that they have applied for the fund to get some support for that.
Okay.
Are you talking about something different, or are you talking about preschools that are in churches and part of Jewish Federation and things like that?
Yeah, that's what I was thinking about, that those programs that are part of congregations, I have not been aware of those groups looking at an opportunity, because even those that are opening up are not likely to be close to capacities that they're used to. And so I'm just wondering if there would be some value to reaching out to them to let them know that there may be a need, especially at a time when we're starting to be mindful of the equity issues, and many of these religious communities the ones that are in the more affluent areas may not even think about the possibility of opening up and applying for these things. So it's just a thought that there may be some partnering there.
They do apply. I do believe they've applied for the child care funding because they're on our mailing list. They're part of all the associations. They're in there is a whole association of church-based and synagogue-based and so on. But the key here is whether they are licensed for school age.
No, I understand that. I understand.
If they're licensed for school age, then they're most likely the parents who have been attending their programs are beating down their doors to get their kids back into their school age program. So there is a likelihood that they are trying to figure that out also. But the key is that if they only run a preschool program, they can't do an elementary, a K-5 or K-6 program.
Okay.
There is also a limit on enrollment for children who are three and older. This is when they cannot have group sizes that includes the teachers for more than 15. Anybody under the age of 3, it continues to be the same ratios and the same group size as is in licensing usually.
Yeah.
Thank you. Pat, you're next.
Actually, I have 2 questions. And one, I wanted to ask about whether or not you were familiar with Montgomery College. I just got a flyer or some information today where they're trying to recruit students who are education or child care majors. You're nodding your head, so you must be familiar with it. So how will you get that information out to the greater community? And my second question, well, maybe I can wait till you finish and then I can ask you the second question.
So Barbara spoke about the Early Childhood Education Initiative, which is sort of been folded into doing this, both the recovery work as well as the initiative work. Part of the funding that the initiative has had has been to provide scholarships at Montgomery College for early childhood educators. And so we've had a scholarship program that we funded a scholarship program at Montgomery College for that. And we are aware that Montgomery College, like many other community colleges, has seen an increase in their enrollment. And so I know that I believe that we have increased the dollar amount this year for scholarships at Montgomery College. Barbara, do you remember the dollar amount, or
the initiative put $250,000 into scholarships from the spring and into the summer sessions, and $500,000 for the full of next year to provide scholarships for those working in the field in early childhood.
Great. Thank you. My second question, because I looked at the guidelines, the state guidelines, and I was comparing them to what the CDC was saying, and I don't know how much input you all have to the state guidelines, probably none, but as you're shaking no. But I wanted to ask, is there, what I saw that stood out, let's say a child, heaven forbid, comes in contact with somebody, is positive or becomes positive, he or she becomes positive. So the parent will have to take the child out of that particular child care facility for, whatever the quarantine period is. But it said something in there which caught my attention, that the parent could not enroll their child in another child care facility during that quarantine period or whatever. I was trying to figure out how you're going to track that. I know it's in the local health department, probably has been notified that the child has come in contact or he or she is positive. But really, how is that tracked? If you could help me with that.
It's state public health that is doing any contact tracing, first off. And then the other piece, I don't think we can track it, but what I can tell you is that all licensed childcare providers are doing the same kinds of things that if you've been to the doctor lately, to be able to get in the door, and parents are not allowed to go in the door. The drop-off is happening outside. And that was in the guidelines as well. And so they are asking parents certain questions. They are taking temperatures every day and a wide variety of other health requirements. You know, so sure, I guess a parent could enroll a child, but they're being asked to certify that they're not enrolling a child with a health issue. And that's true of, you know, communicable diseases too. It's not only COVID. We have a whole set of codes around communicable diseases in general for childcare.
Thank you.
Christy.
Yeah, just first a comment and then a question. I just wanted to reiterate some of what Laura and John said early on, as well as some of the comments that Bridget has made in the chat box. I'm on the board of Highland Elementary School PTA, and I'm also a cluster coordinator for the Einstein cluster. Like John and Bridget's children's schools, Highland is a school that has over 80% farms. And I think in looking for these opportunities, yeah, it's definitely important to be communicating with the counselors and principals. But, you know, obviously those are high areas of need, and we need to focus in on how to get some of those resources directly to parents and make it easy for parents. And to the point that someone made, like figuring out how we can make sure that we don't have 7 different funds in different places that people are contributing to, and streamlining that process to get the most money in the right place so that the most people can access it and the most people can donate to it would really be helpful, I think. So just wanted to make that point. My question is about just overall capacity and what types of assessments you've done on what that's going to look like. I mean, obviously there are some unknowns with the use of MCPS facilities, but have you taken a look at the overall need for care for both low income and disadvantaged populations, but also for others, to see kind of what that gap is going to look like and how it'll phase in over time, and just how do we plan on dealing with some of that as people need to start going back into work eventually here.
So I'll come back again to the early childhood initiative that we've been working on, and one of the action items for this spring was to do, this is all pre-COVID, right, was to do a supply and demand study for the county, because we have an idea of what the pre-COVID supply was, because we know how many licensed home teachers there are, and how many licenses are out there and so on. So we have an idea of what the supply is, but we don't really have a really good handle on the demand. And so, like many other jurisdictions, we're looking at and have the funds to do a supply and demand study. I'm, in fact, glad we didn't get to it last fall, because it's going to really change significantly. We don't yet know who's going to open and when, and if they will open. Whether that's school-based or community-based, home-based, or whatever. We don't have a good read of that yet, and I think it's going to be a while before we can get a full read of what that is. And we know that for at least the foreseeable future, whatever capacity those that are open have, it's cut by about 40% because of the reduction in size. That has a lot of implications for our youngest children in particular, because if you're a provider and your capacity is, let's say 100, you're down to, let's say 50% to be easy, 50 kids. And you've got a lot of school-age parents pushing to have their children in a school-age setting, and you can get up to 15 people in a room, and you can get paid for that. You're not going to do 8 babies. And so from even a business perspective, as a childcare center, you're trying to figure out how to make ends meet at 50% capacity. Like any of the other businesses we know that have had to reduce number of tables, a number of, that's exactly the kind of thing that you're dealing with. So we have those two factors, the factor of who's going to open and when and if they can, and the factor and the capacity piece. And I don't think we should do a supply and demand study until things have settled a bit, because I think it's going to be very difficult to gauge. I think there are a lot who are going to try to open and then may not succeed. We have a very large number of family childcare in the county. It's a significant number. And if there is one family member in those homes or one child, that shuts down, and that's a number of slots right off the bat. So I think we're all going to kind of guesstimate, look at national trends, look at others, and try to gauge it. But it'll be a while before we have the kinds of numbers that you're thinking about, Christy. But it's a great question, and it's one that we were hoping to be able to answer by this spring. Barbara?
I was just going to say there's 800 family child care programs in the county, and there's 500 center-based, which includes the faith-based programs that we were talking about earlier.
But the capacities of those all vary significantly.
They're all reduced. And the other thing is that in a family child care home, I don't know if this is what you were saying, Bibi, but in a family child care home, the members of the household count in that number of how many they're allowed to have in the space. So that reduces how many children they can bring in for care in the family child care home, because obviously it's about how many people are in a space.
And if you consider that many of those are probably the stable people in the household, in the family, and with the losses of rental and others, you have people doubling up, the likelihood is that some of those spaces also get reduced, not because they can't open, but because their family size now is bigger. So there are a lot of, and it's a really complex issue.
Yeah, and also just adding in the complexity of what employers are planning to do in the region in terms of bringing people back to work. So
we may find that the structure and the business of childcare may change as we look at the fact that employers may vary schedules differently have schedules or work schedules differently, and much more combination of at home and in the office, and where people's schedules will be different than what they've required or needed to do in the past. So I think it's a highly impacted business in terms of what may be the decisions that employers make.
Thanks. There was a question in the chat as to whether or not we're tracking COVID-19 stats for childcare programs that have been open.
Do we have anybody from the health department here? I will tell you that the one question we're asking, and again, Barbara, help, is that the child care centers or family child care homes are required to report their health, whole series, not just COVID, but communicable diseases, et cetera, to the state Department of Ed. That information doesn't always necessarily make its way down to the county in an organized and structured way, and it's one of the questions we've asked. Because we should have a much better sense. And then the health department to HHS. And so you've got these 3 steps in terms of, but they're not required to let the county know. Am I correct, Barbara? Did I characterize that right?
What they have to do if they have a suspected case or a case is call their licensing specialist, which is the state, and call their local public health for guidance. But it is the state public health that is doing the contact tracing and is keeping any statistics. I can tell you that in a statement that was related to the whole independent school question that the health secretary made the other day, there was a statement in it that child care programs that have been open for essential employees and that camps have shown that they can do this safely with very few COVID positives. So that was a statement from the Secretary of Health, but I don't have any statistics to back that up.
But the follow-up question to that is, what is our rate of testing with children? because we know that children are, I'm not a health expert, but we know that they may be asymptomatic and we may in fact not be capturing. And that's the big issue right now, and what we're hearing across the country is the fact that, and Earl, I know you don't have your public health hat here, but you're a public health guy, but we know that that's a big issue, is that we have really under-tested children because we thought children were safe from this. And now we're finding that children are carriers of, and may in fact be positive, and we've just not tested. In fact, we've begun to talk about doing some communications and media strategy around family testing for those very reasons. And what we've seen most recently is the number of positive African American and Latino children being much higher than their white counterparts. So I think all of those raise a whole set of issues. We are going to constantly be learning about this disease, and it's going to constantly be changing. Earl, I don't know if I've misspoken on that or not.
Yeah, so right now our 0 to 19 is about 17% of our cases. If you looked at that number a month ago, that was roughly 9%. So we're roughly double over the last month where we were at in terms of representation of children and young adults in our overall case totals. That is largely likely an artifact of under-testing earlier, not some huge surge in that case. Right. So now, we are looking to connect particularly the immunization effort around getting people tested as well. We know early childhood immunization typically occurs through our school systems, largely in the fall as kids start in the fall. We recognize that with the schools being mostly remote, that will be challenged this year. And so part of our campaign around getting people vaccinated will also include getting them tested when they come in as well to be vaccinated. So we're looking to put out messaging to not just, and we're not talking about just county venues, obviously we have to make sure that our physicians in right. healthcare are doing the same thing. And so, and our clinics are doing the same thing for that matter, just so we cover all bases in terms of providing opportunities for testing in concert so that we understand the burden of illness in our young people. Yes, they have a higher percentage of asymptomatic cases, but they seem fully capable of transmitting virus and harboring it. So, and not to say that there aren't those students who do have severe complications, because there are, and that's something we're obviously concerned about in light of, the fall and what will happen with the schools and things.
Thanks, Earl. John, did you raise your hand again?
I had not.
Okay, just checking if it's still frozen. Okay. Pat, did you raise your hand again? Okay.
You had mentioned something about thank you, Elijah. You had, one of you, BB or Barbara, mentioned the subsidy, childcare subsidy. And I just want to know, I'm sure there's a cutoff for the income that will get it, but because of COVID, there are a lot of people, may not meet the income or exceed the income. I'm talking about the working poor.
Yep.
Is there going to be like a sliding scale or something considered so that at least those who fit in, they're still the working poor, may be considered somehow to get some dollars to help them with the child care? We've seen that with the eviction subsidy, where that was the same case. They still had the same issues, but they weren't eligible. So it's the same kind of situation where they're just right in that little window that they're still struggling. Yeah. And they need to have some help. So just consideration on how you would help, or take, go back to the drawing board if there is one, and figure out how you can help that group, especially for our Black and brown kids, parents.
I would say a couple of things. One, was really encouraging prior to COVID that the feds were increasing their subsidy dollars to states, and at least in Maryland, the amount of subsidy had begun to increase, and and the eligibility had begun to go up. I think we went up to about 300 and 350% of poverty. Correct, Barbara? Something like that.
I think it's 320, but I would have to check.
Something like that, which was I'm trying to, Barbara, do you remember like where we were 2 years ago and then a year ago and where we are now in terms of?
Yvonne Iskandari leads our Working Parents Assistance Program and all of our eligibility programs. So I really need her for that. I do know that we were one of the lowest in the nation, and that's one of the reasons that we are, the state committed to making the change. I also know that because of COVID, they've stopped increasing for the moment. So that's another issue in terms of what money is in the budget to put into continued increasing of the subsidies. And then we do have the Working Parents Assistance Program, which is for working parents, which currently it's for a period of time as the state was raising their eligibility and level of poverty and how much they were reimbursing, we were actually supplementing so that if someone had been on Working Parents Assistance Program, but now they had really transferred over to the state because 90% of the Working Parents Assistance Program families moved over to the state because they were covering more of it, we were providing a supplement so that they did not get less than they had received prior when they were on Working Parents Assistance Program. And the reason the whole program exists in Montgomery County is it costs more in Montgomery County to do care and to pay for care.
And Pat, I would also say that, all of the subsidies, with the exception of Head Start and Early Head Start, are working parent subsidies. The federal to state and the state to local, as well as there's a requirement that parents are working or in some training, some sort of 20 hours a week training and so on. What I will say to you is that I think the families that we're talking about in particular may have slipped down below 300% during this period. And unlike other subsidies, childcare is not, let me see your taxes from last year necessarily, but it is your current payroll, your current stub. So there is a likelihood that some of the parents who have, now if they're not working at all, that's a different thing, right? But if they are working, that they may qualify, given the increase in the state in terms, and again, I think we were in the right trajectory. I don't know what will happen. So that's one. The second answer is, if in fact this kind of scholarship type of fund gets created, it may be very possible that those dollars, which are not guided by any federal regulations or any could be for parents at other levels of income than the ones that are guided by the eligibility requirements of the state or our WPA. And so that's something certainly to go back to the group that's working on trying to figure out. So how it's difficult, because and I will say to you that I would encourage
I think BB froze. Give her a second here. Technology, it happens. We'll wait for BB to rejoin us. In the meantime, Laura, you had your hand raised.
Yeah, I actually put a question in the chat, but it's pretty busy, so figured I'd give it outside. Are we looking at using parks and recreation facilities as well to expand that capacity? Also, there's a lot of studies out there that outdoors is safest. So we could use outdoor spaces to help support families?
Yeah, there is a whole committee focused on recreation and not the same kind of childcare that we're talking about, but programs for children and youth. And they are working on a number of different opportunities. Excel Beyond the Bell is one of those opportunities, but they have a number of contractors that provide things in elementary schools and in middle schools for students. So recreation is actively coming up with possibilities and opportunities that can work within the school system to provide opportunities both indoors and outdoors for students.
Thanks.
Thanks, Laura. Hey, Peter, did you want to ask that question, or did you just want to leave it in the chat?
Sorry. I guess I can ask that question. Having my grandkids over, and they're in 3 grades, both, I mean, elementary, middle school, and grade school. Parents work full time. One parent has to actually report to work. The other works from home full time. And as you've heard, parents working from home nowadays are basically putting in more hours than they used to when they used to work at an office or wherever. My experience, and I'm sure this could be related by a lot of other parents and multi-generational family members who take care of kids, is that even during the summer school, it was very difficult in trying to coordinate the kids, monitoring the kids, making sure that they knew what they were doing, they were understanding what the teacher was saying, they were following directions. And now we're converting to a full day, 5 to 4 days a week, 5 days every day for the elementary school kids and 4 days for the middle school and high school kids. And they're going full days. And now you have people like myself or parents who have to monitor these kids. And that's going to put a lot of stress on me. I know the summer session put a lot of stress on me. And I was just wondering, has the county MCPS is not here, but this is more from a county basis, I think, is under this recovery. What is the county doing to look at the mental wellness of these multi-generational and parental caregivers who have to not only do their regular work, but also sort of monitor the kids, which the teachers used to do in the old days, but now that they have to do at home, and sort of make sure that everybody's following directions. You know, I don't know how that's going to be done. It's a challenge that I'm facing, but I was just wondering, am I the only one alone? And this is I guess a component or a gap that hasn't been discussed from what I've heard.
Peter, we're all losing our minds.
I mean, you know, you're not alone. And you know, the whole idea of trying to get some of these early child care centers open for families who actually have to leave the home to go work. You're right. I mean, I don't think there's a single parent I've heard from that said, oh, this is great, I'm having a wonderful time. And I really have been able to juggle my 8 hours of Zoom meetings with my 8 hours of 3rd grade math, and then reading and so on. So I think you're absolutely right. And I do think that it's taken a toll on folks. I know that school systems, and I believe MCPS is one of those, are doing these webinars to help parents understand how to support their kids, or caregivers understand how to support kids in home. That's some tips and helping you, especially, you know, somebody who may not be fully savvy and so on. You add on top of, I mean, technology savvy. You add on top of that the fact that not everybody has the same level of connectivity, and you have 3 kids trying to be online doing work, and the strain on connectivity for that. I mean, this is just a statement of commiserating with you. I have no answers to. I mean, I think, like you, hundreds and thousands of parents across the country and caregivers across the country are asking the same question.
Thank you.
John, yeah, go ahead.
Yeah, thanks. to follow up, well, two-part question to sort of follow up on that, BB. I'm wondering if some of the childcare providers will be providing, are they only going to be for week, for day? Will they have opportunities for drop-in? Because related to Peter's question, I could see that if a parent got to that point after 3 or 4 days, that maybe they don't need an entire week of childcare, but they need a day to be able to have their child in a setting. So that's my first question. And then a second question, a lot of what we've talked about is around education. And I'm curious, not that childcare providers oftentimes aren't involved in education aspects, either before care or after care, but it's oftentimes in a very different situation where after care, you're bringing kids together to maybe help with homework or things like that. What type of expectations are there for the childcare providers, especially those who are going to be using MCPS facilities, to be providing some type of support around the distance learning, so that it's not just that these students or these children are going to a facility for 6 hours, but they're not doing any of the schoolwork that they should be doing?
John, I think you've been at all of our meetings. We've had the same conversation, and Barbara can talk about the fact that she's having those conversations already. We, in the same way as I just mentioned that schools are providing these webinars for parents, we have been asking to see whether there's a way to provide similar kind of support for providers, but maybe Barbara has more update on that.
I don't have an update on that specifically, but I will say that the majority of the school-age providers, if not all of them that are in the schools, are planning to provide support. They're not planning to provide a camp atmosphere for the entire day. There will be learning sections of the day. There will be play and relaxation sections of the day. There will be getting outside sections of the day. And there is a coalition of school-age childcare providers, and they're the ones that community use of public facilities and that the school system has been working with to work out how this will work. But as Bibi said, I'm trying to have conversations with MCPS about what, you know, if you're doing webinars for parents, can we tweak those to make them be for childcare and help people just know what the day is supposed to look like as much as anything. I think one of the things that gets misunderstood, though, is that childcare providers are not people who do not teach. And many of them may know a great deal about distance learning that sometimes our school system can learn from. So it is a two-way street, and I don't want to just turn it into, oh, MCPS is going to train everybody.
Right.
I think the training would be greatly valued by many childcare providers, not just the school-age childcare providers. You know, there are family childcare providers who are going to start taking in more school-age kids for full days, and they would really appreciate knowing what a virtual day is supposed to look like and what the expectations are on the part of the schools.
So Barbara, I'm assuming, you know, so MCPS has put out its draft for recovery that has some of those schedules listed for elementary, middle, and high schools, and that would probably be a good place to start there to get a sense of what a schedule would look like.
Right.
Yeah, in the conversations they've had, what we have heard is that they, in fact, especially those that are based in the schools, but it should be across the board, is having a good understanding of what the school day looks like virtually, so that they can complement that and so have breaks at the times when the school is planning breaks and that sort of thing, so that children aren't losing time on their screens for the work that they are supposed to be accomplishing.
So that I do want to kind of go back into the chat, and Tiffany actually made a point earlier that she was concerned that many families may choose illegal, unlicensed, and unregulated childcare as a result of dealing with this, and there should be a certain level of public education about the dangers of this. Do you all have any comments, Bibi or Barbara, on that?
I mean, I think she's absolutely right. I think that it's already been happening. And it was happening before, right? Before COVID, because our supply and our costs are very high. And so I'm sure that there are a lot of families who were either because they have non-traditional work hours and they require somebody to care for their kids at hours where childcare centers aren't open, or because they can't afford for multiple children, a full day care for the baby and before and after for the elementary school age children, when there are 2, 3, or 4 children in the household. So I think families, we know that families were already resorting to what was doable for them. This has exacerbated that situation even more so. And again, it's more to agree than to say I have a solution or we have a solution for it. I think I do think that a public information campaign is really important to do that. But I think it's also, you know, there's a level of frustration of families in terms of what do we do that is, again, not unique here and not unique in the county, and it's what I'm hearing across the country.
Thanks. Tiffany, did you want to add to that? I saw you put another comment in there. I don't want to put you on the spot, but I want to make sure you can.
I didn't have anything else to add. Just that I think it's important for families to know that it's very dangerous and that childcare providers are licensed and qualified and able to teach.
If I caught all of that or some of that, Tiffany, I would say, you know, if you were reiterating what Barbara was saying, that providers are very often capable and able to teach, and many of them have multiple certificates and so on. But I also saw that you stated that they need support in terms of virtual learning, and that's exactly what we're working on. And Barbara was speaking to, and that is the getting MCPS to provide guidance as to how it's not so much about how to teach and but what does their virtual learning platform look like? How is it that they are expecting children to respond and react? What are the parameters? What are the, how does that work so that a child care teacher can in fact give them the kind of support that they need. I think, you know, I come out of that world for many, many, many years, and I know that we're very competent at being able to help children and teach children in the child care community. But understanding the school system, I think would be very helpful. I don't know if I caught what you were saying, but I think that's some of what you were saying. You were breaking up, so it was hard to say.
Thanks. Bridget, did you want to ask that question or did you want me to?
Yeah, I'm happy to ask it. It's just Bridget Howe, and I'm participating in this as a private citizen, I guess. I'm kind of curious about some of the physical resources that these childcare facilities, especially with school-age kids, are going to have when the kids are going to be doing the online schooling. Because I'm thinking about my son's elementary school, where like the Wi-Fi is terrible. There's not a ton of outlets. The aftercare program, which I think is going to be a full day program, has been traditionally located in the all-purpose room where the sound doesn't carry very well, or actually it echoes. So what considerations are being given to ensuring that children are getting facilities that will help them learn virtually when they are going to these physical locations?
Right. So one of the things that MCPS has been talking about is, instead of using the all-purpose room, in part because they may need that for distributing food, they'll be using classrooms. So they will be in classroom settings and set up for distancing and smaller groups. And as you know, MCPS is providing they're not laptops, whatever they are, Chromebooks, and connectivity if children don't have connectivity at home in terms of hotspots. But you're right to raise it, we did just bring that up today in terms of how can we help in the conversation of being sure that connectivity is going to work when they're in the school building. So we have the issue of connectivity maybe not working at home when you've got 3 kids trying to be on the internet at the same time. We also have the issue of connectivity in schools, and it may vary from school to school. So we actually just raised that in our meeting today.
Oh, good. I'm glad to hear that. I have 2 quick follow-ups from that. One being, I believe I remember hearing in the spring that when they did the Chromebook distribution, part of what they had to do was disable something about the connection that works in the MCPS network so that people could use it at home. So I would be especially concerned for the kids who are going to be, attending care in MCPS buildings, that they're also able to then use the Chromebooks at home.
Okay, that's a great point. Yeah.
Yeah, that's a technology issue that can be resolved. The second one is then, if they're going to go from being in a multi-purpose room to being in multiple classrooms, doesn't that change the need for adult supervision? And then won't that have a cost factor if they have to have more adults present?
Well,
go ahead, Dee. So I don't know that they're going to have more adults present. They're licensed for a certain number of students, and they are sometimes in multiple classrooms. They're not always in the all-purpose room alone. Sometimes it's the all-purpose room and the art room. It depends upon the number that they are licensed for. And then it will depend upon what space they're given, because they can only have 15 people in a space.
Okay, and again, I'm just thinking about my son's school, former school, where, there might have been 30 kids in the aftercare in the multipurpose room, and with social distancing, if they were in classrooms, they'd probably need to be in 3 classrooms. So just thinking about the logistics of the required adults for that. But thank you, that was really helpful.
Well, Laura made asked a question, I think, about legal issues surrounding pods, and we'll get the information or link to the regulations. I think we can do that. Unfortunately, I don't have anything here that I can give you a link right away, but certainly the MSD website has all the regulations for childcare clearly specified. Barbara, do you know off the top where folks would find that?
You need to look at the MSD website, go into divisions and into the early childhood division, and then it's the Office of Child Care or the licensing branch. Either one of them you should be able to pull them up. We could send that out afterwards. BB, as you know, Jennifer Arnaz, who runs our R&R, would be able to do this on the spot, but she's not here.
She would.
Yeah, the reason I ask this is I know there's a lot of parents out there recruiting for pods right now.
They are.
And
they're renting Airbnbs.
And some of them, we kind of want to share best practices, and make sure people know what's legal and not legal, and also the safety issues. What happens if someone comes up positive for COVID? I would hate for us to, parents to start doing community spread on their own instead of in the school building. So this is just something I think we need to be very clear in messaging, because it's going to happen.
Yep.
They're happening. So we need to get control of the situation.
Yep.
Can I ask a question? I'm sorry that I was late, and if you've covered this, just shut me up.
Hi, Fran.
Hi, BB. How are you? I had, unfortunately, I had something else I had to do. It sounds as if most of the discussion is around school-age children's childcare. I sent Adriana and Laura a summary of a conversation I had, or an email from a family childcare provider not far from me in Tacoma Park, who cares for young children. And she said they are planning, as much as possible, a completely outdoor education. That is obviously the safest from a COVID perspective, especially if you're not going to be able to go into all of the classrooms and school buildings and childcare centers and upgrade the ventilation. And I wondered why that is, and there's experience, this is not my area of expertise, which is why I talked to someone who knows something. There's been a lot of thought given around the country to how to do outdoor education even before COVID. And I wondered whether that was something being considered. That's question one. Question two is, why is nobody from the Board of Ed on this call? It would seem to me that they should have been. And I don't know who is who on the call well enough to know if people are MCPS employees, but I hope you will convey all of this to them, because it's just odd that they're not on here. And then the third thing is, it's becoming clearer that with any luck, after January 20th, we will have to shut the country down again for 4 to 6 weeks in order to get this under control. There just doesn't seem to be any other way to stop the pandemic. Is the planning we're doing now, or the planning you're doing, extending to those long-term kinds of issues? Because when it happens, it'll happen fast, and it would be good to have the planning in place.
Fran, such easy questions.
Aren't you glad I wasn't here for the whole thing?
So gracious of you. At 9 o'clock, before not having had dinner yet, since I've been on the Zoom since 2 o'clock. Now, on the outdoor piece, you know, one of the things, first of all, you missed our whole early childhood side of this conversation. We did spend a lot of time talking about all of that we are doing around early childhood. In one of the things Barbara talked about was these sessions that we had over several weeks with providers on Monday evenings, sort of open sessions to discuss their concerns and their issues, and to share best practices about what they were doing. And a lot of the conversations with the family childcare providers were exactly around that. It was summer, it was, you know, these happened in May and June and so on. And so there was a lot of conversation. A lot of providers who had access were saying, we're spending most of our day outdoors, unless it gets too hot or it rains. And in fact, they were doing as much as they could outdoors. They were putting all their hand washing and sanitizing and everything before parents came in the door. And we heard the same from childcare centers. Obviously, as the weather begins to change and so on, those kinds of things begin to change. And there's going to be, I'm sure, a lot of fears about children being out in the cold with viruses and all. I don't even want to get into all of that. But I do agree with whoever the provider that you were talking to. I heard that from providers. I was on these chats on Mondays and heard a lot from them around the outdoor piece. And certainly that was I think that was also a lot of the discussion in the rec group, a separate group that was working on recreational programs and so on, that there was a lot of discussion about the value of some of these summer camps being all outdoors and doing all of the outdoor piece. So I can't answer the question of whether MCPS was invited or not, but we did share a lot of what conversations Barbara in particular is having with all of the MCPS folks, and how we have arrived at some of these agreements have been a lot of collaborative work between HHS, MCPS, and CUPS and providers, obviously, and the out of school time childcare providers. But that's been a lot of the conversation. They've been in all of our committee meetings, both on the early childhood side, on the school age side. MCPS has been a good partner around that, and a very helpful and willing partner. Barbara, I don't know if there was anything else that I missed around what we're. I don't remember, Fran. Your third question is for the future. Holy cow! Our future plan. I mean, no. We talked maybe before you got on the call about what national sort of studies and research is telling us about what may happen to childcare as we move into the next 6 months and the next year, and how not having to do with necessarily whether we're going to have to shut down as a country or not, but the fact is that will they survive anyway because of the losses in income that they've had, and the fact that the current group sizing regulations are such that none of them can be at capacity, and that would make their just a financial viability really it would put it in question.
Thank you. Phoebe, I'll send you the information that the providers sent to me. I had sent it to Laura and to Adriana.
Okay.
And you can share it around.
Thank you, Fran.
Great. We got time for maybe one more question. We're at 8:50. Vivi has not had dinner yet. We want to be respectful. Looking around, anything in the chat, looking for people physically raising hands. Going once, going twice. Okay. I think that will be the end of the question and answer period. We want to thank Bibi and Barbara for joining us this evening.
Do we have a next meeting scheduled?
Yes, we do. We have
okay, thank you.
No problem, of the 3rd. September 3rd will be the next meeting. I believe that's a Thursday at 7 p.m. We're trying to alternate some of the days here for those who have standing meetings on Tuesdays and Wednesdays, so on, to make sure that you're able to join us. But thank you, Bibi and Barbara, for joining us this evening. Certainly you've given us a lot to ruminate on, to consider as in terms of childcare issues here in Montgomery County. We appreciate you all's work on the issue. This is a trying time, especially for those of us who have school-age children, little 3- and 4-year-old children who refuse to take naps during the day. And that's why Daddy looks tired this time of night.
You know, childcare has a lot of tricks about nap time.
Oh, I need to learn some.
Now I just let my kids opt out.
Oh my God.
Well, thank you for asking us.
Eli, you said September 3rd at 7?
That's correct.
Thank you.
No problem.
Will there be a focus the way there was for this one?
So what I want to do is I just want to give us a few minutes to kind of survey you all to find out if there's any specific issue or topic that you all would like to focus in on so that we can prepare by inviting the appropriate folks to that meeting. So
I'm going to say goodbye and thank you very much for having us. And I am more than delighted that childcare was an issue for a full meeting, as long as this was. Really valuable.
Thank you.
Thanks, Bibi.
Thank you, Bibi. You're a wealth of resource. Thank you.
Thank you.
I want to thank Kimberly Rusnak for jumping on too from the Children's Opportunity Fund, being out in the audience and then joining you all to answer some questions this evening as well too. So thanks, Kimberly, for doing that. We appreciate it. But Fran, to your point, I want to survey you all to find out if there is a specific issue or some topics that you all have offhand that you would like to focus in on for the 3rd. So you can throw something in the chat if you want to, or suggest something here. But we want to open it up to you all.
I'd love to talk about workforce development.
Okay.
From the disability community, both in terms of folks with disabilities getting jobs, but also finding people to work in these long-term care programs where the need has always been great. And so this is a really good time for us to perhaps look at some of these opportunities.
Okay. We'll vote for workforce development. I got another vote here around safety for voting.
I wanted to add in, I've noticed recently that a lot more businesses and restaurants are closing. So I'm wondering if we might want to revisit some of the financial impact conversation around, supporting small businesses and employers in the county.
Okay. Bridget.
I think you could probably even pair that with some of the workforce discussion.
Mm-hmm. Small business, workforce, voting. And by all means, if we don't necessarily choose one of these topics for the very next meeting, we should do it for the meeting after that or what have you. So I'm seeing mental health. So what we can do is we're going to put some of these topics right now into your Zoom interface and allow for you to vote in real time. Okay. So they're preparing that right now. The same type.
How about looking to maybe opening schools back up next semester? I think we need to talk about testing protocols. What's coming down the line as far as testing for COVID and the length of time it takes to get back results and contact tracing, et cetera, so we could actually try to open up schools. I think that's the only way we're going to be able to do it.
Okay.
Can I also offer food security issues potentially, even if it's not in September, but just to cover that at some point. And I also mentioned in the chat, maybe just getting a quick update on how the eviction prevention program is going, since September will be sort of prime time after that portal opens, even if that's not the focus of the meeting, but just to get a small update on that.
What about family violence? It's way up, and without people going to school, there's no way for people to like monitor children who are victims, or anybody who's a victim.
I believe Asim from DHCA is working on the tenant eviction component, so he might be brought back. I know he's a member of this group, so he might be brought back to address that also. And I agree with the food security component. That's a major one. Every weekend you go anywhere up and down the county, and there are lines of cars along churches and county facilities. So that's a good topic to bring up also.
So you should have your survey in front of you also, if you could just take a moment to vote here for the next topic. And once again, even if it doesn't come up in the September 3rd meeting, we could certainly have it following that as a topic. It gives us time to prepare speakers, reach out to some folks, get them set up. So
what is it you most need from us?
Everything.
Sure. Okay. No, I'm very serious. I mean, there probably are things at the top of your list.
Well, I just think having this, and I don't want to speak for Earl because he's not here, but I think really just having this feedback for the county and for the county executive and council is really important. There are a lot of thoughts that you all come up with and feedback that folks don't think about in many cases. So I think this has been instrumental as in terms of informing some of the recovery efforts. So, all these topics have been important and really been shaped by you all's viewpoints. I think that there won't be anything I would say that I don't think the community voice isn't important.
And I'll add to that, though. I think Fran is right. What do you need us for in the sense of providing feedback? But also, is there a way that we can serve as being ambassadors of sharing information with our networks? Several of us are involved in PTA, many other civic groups. So let's make it a two-way distribution of information.
Yeah, if I could just add in here, I'm Tina LeBoy from the Office of Emergency Management. I work for Earl Stoddard. Part of the purpose for this group was indeed to have that two-way street. It's to be a sounding board for the county's recovery framework and actions, but also to utilize the networks that you all have connections to spread out any kind of information that we have through the recovery organization, so that we can better distribute the information to the community.
Well, what I did was basically the write-up that was sent out a couple of weeks ago by Craig, by this group. I shared it with my community and basically asked them for feedback on what they saw was missing out of the discussion that had taken place. So that's what I do to get the priority subject items that I talk about when I talk here. The other thing, Elijah, is this voting. I think if you did it in a priority voting, just let people rate 1, 2, 3, 4, 5, 6. That would give you a better idea of where things would shake out as to your priority, as to what items to discuss next time.
I think also that you all have a better sense of timing of when this input is most needed. So, some of this is like, sure, I want to talk about all of this stuff, but what should be next versus what should be, after that, I don't have a good sense of.
I think that's fair, and I think Tina hit it right on the head. The child care issue is something that's definitely important right now as some childcare places are opening or we're getting closer back to the time that school would traditionally be open. So I think that was very timely. So I agree with the thought that we should probably try to organize these things from the aspect of what impact around some real-time decisions need to be made and how your feedback can feed into that will be instrumental. So let's see where we're at with the survey here and then see if we can quickly do some sort of Likert scale or ranking scale.
The current poll, 23 out of 28 people have voted. For the 5 who have not voted, I'll give you one last chance just for this preliminary poll. And I'll close it. So voting was the top issue with 9 votes, followed by mental health with 7 votes, financial impact of business closure with 5 votes, food security with 4 votes. I think we could relaunch a poll that we could just send to the group. We can do that in the next couple of days where we can order them.
And if you all have any additional ideas outside of tonight too, feel free to email those over as well. That'll be helpful. You can see the breakdown here.
I think voting might not take the whole time.
Right.
I don't know. So maybe it can be combined with something else. It is timely though.
You know, that could be an hour of the 2-hour meeting. The second hour could be a different topic. With an update.
I agree. I almost feel like we might have missed our opportunity to have an impact on the voting conversation since the state board made decisions recently. But I think it's important that we all be informed about it. But I don't think it'll take 2 hours.
Okay, well, we'll get something out to you all soon in the next few days here and figure some stuff out, maybe run some ideas past you. Feel free to give us some feedback around some of those ideas, but certainly we can break this up into 2 hours over the course of the next meeting with voting, spending, you know, an hour on that, and the second hour a different topic, as well as some updates, such as on the eviction issue that William brought up, and some other topics as well too. In the meantime, please make sure that if you get the opportunity, when you get the emails, to read the recovery site reports, as well as the COVID newsletter that's sent out to you all. There's some really good information in there that may help to inform some of the thoughts that you have as we move forward as well too. And for the census, okay.
Yeah.
Good point. So see, some ideas will probably pop into your head even after we close tonight. So feel free to share that with us, please, as we get ready to move into the next one. Okay.
Just as a note,
ahead,
just as a note, one of the things I do when I answer the phone, regardless of who calls, is I ask them if they've filled out the census and if they've registered to vote. I just make that a practice. So anyway, that's my 2 cents.
Yeah.
I love that.
Yeah, thanks for that, Peter. And road safety, I did see that, Bridget. So we will get all this stuff together. We'll get information out to you all. The most important thing in between now and the next meeting is please be safe, everyone. Continue to social distance, mask up, do all these things. We want to make sure that you're here with us for the next one, right? So enjoy the weather, but don't get too close to folks who don't live in your house or anything like that, okay? Good seeing everyone this evening. Be safe. We look forward to seeing you next time. Thanks, Adriana, Tina, Ben. Earl's not with us. He left. But thanks to everyone who did the work this evening, and we'll see you on the 3rd.
Great. Thank you so much.
Take care, everyone.